Hi, my name is Emma Moore, and I wanted to take the time to talk a little bit about my practice as a therapist and give some background about myself. So, I'm an associate marriage and family therapist, and I received my training and education from Pepperdine University. And during my time at grad school, I gained a wealth of experience and knowledge. I worked at a women's center, I worked at a dual diagnosis clinic. I was trained in dialectical behavior therapy by one of the pioneers of DBT. His name is Charlie Swenson. And then I also worked at a crisis residential treatment facility, and I gained a lot of experience working with individuals who have more severe mental health diagnoses. And so in my training, I gained experience working with diagnoses like PTSD, schizophrenia, bipolar. And upon graduating, I decided I wanted to pursue private practice. And so that's what I do now. My private practice is solely through Zoom, and I offer sessions into like late evenings. So that's been really beneficial for clients that have a very busy schedule and they work all day and they're not able to see a traditional therapist in the morning or in the afternoons. And so I'll see clients ranging from afternoon until my last session is usually around 9 o'clock. And the services I offer are variable depending on who wants to see me. So I get some clients that are struggling with anxiety, depression, addiction, agoraphobia. I get a very wide range of individuals that I see. I specialize in trauma, and I have a passion for helping individuals with trauma or disorders that have come about from trauma. And then I also work with couples. And so the couples that I see are typically married and they're experiencing some kind of conflict or gridlock. And so part of my job is helping them navigate that gridlock. And I use the Gottman method and imago therapy when I see couples. And yeah, my practice, the way that I would describe myself and my approach is I'm very warm, I'm very in tune with my clients. I'm extremely empathetic. I think that's a big part of being a therapist, is wanting to help people. But I'm very analytical. And so when I was younger and even in undergrad, I had this draw to studying philosophy and analyzing certain things. And I think that served me as a therapist, especially when it comes to analyzing childhood and really diving deep into these issues that are affecting and plaguing adults that have, stemmed all the way back from when they were 2 years old or 4 years old. So yeah, I would consider myself to be very analytical, and I tell my clients beforehand I can ask very hard, difficult, challenging questions, but part of that is getting to the root of the problem, and that is so significant in therapy. And I feel it doesn't get done often enough. And so for me, I like to work as effectively as possible, get to the root of the problem, and then begin with treatment. And so another part of my services is that I spend a great deal of time tailoring and creating special treatment plans for my clients. And what this looks like is I will have a few sessions meeting with them and learning everything about their background, their history, their symptoms, their culture, and how these factors intertwine to shape how they see the world and how they experience others around them, and then how they experience their mental health. And from there, I take all of that information and I create a conceptualization and idea for why I think they're struggling with the issues that they're struggling with. And after that, I create a treatment plan. And this is basically based on the therapeutic modalities that can be used to treat their problems. And so with my clients, a lot of my treatment plans and the things that I see fit for them is usually involving restructuring their thinking patterns, reframing how they view certain situations, diving into childhood history and trauma, and discovering how it's currently impacting their body and their symptoms and their thought patterns, recognizing distorted thinking, and then implementing different skills. So it could be coping mechanisms, it could be breathing techniques, developing a source of community. So there's a million different skills that, us as therapists have to learn and be able to implement that at the right place and the right time with clients. And another thing about my practice is that I work under a licensed clinician. Her name is Lisa Chen, and she kind of oversees the work that I do. And I'm supervised by a man named Robert Northcutt, who's been a therapist for many, many years, and he's very knowledgeable. And so when I have a very complex case, I seek consultation from Bob, and he's wonderful at kind of steering me as a therapist and guiding me. And that's what we do as therapists. We work together, we collaborate, we figure out the best way to kind of get to the source of the problem and how to navigate that with clients. And so that's a big part of behind the scenes of private practice, is being able to work with therapists and work with your supervisor to understand your clients better. And for me, behind the scenes, I do a lot of note taking, a lot of analyzing, case conceptualization for my clients, and I want to make sure that they feel fully supported. I've seen therapists before in the past that they like to kind of sit there and listen and nod their head, and I've been a client myself, and I know how it feels when you're in those therapy sessions and you're not sure exactly what you're getting out of it. So for me, I spend a lot of time sending emails to my clients about, I want you to do this for homework, and providing psychoeducation, which is explaining what we're working on, how it's going to be effective, giving them more information about the issues that they're struggling with. So I'm very actively involved with all of my clients, and I'm always emailing them, and I'm always in communication with them. And part of being a therapist is making sure that they feel supported, but also that they can build the tools to go thrive and be successful on their own. So that's a little bit about me, and thank you for watching.